Dr. Agnes Achiamaa Anane.
Prof. Chair, permitting me to stand on already existing protocol to just give a word of advice to my brothers and sisters. I want to use this opportunity to thank the Dean and faculty members for this great opportunity. It is indeed a privilege, and I'm humbly honored to be here today to address this distinguished gathering. Yes, my presence here today just gives me a reflection of so many years ago when I was also here in Region, and I'm so excited about this milestone that you have achieved. And I want to say that indeed, medical school comes with a lot of challenges, but then it's doable. I want to talk about a few issues, the purpose or the drive that made you choose this career. You should still have it in mind and make steps to ensure that you are able to achieve it. Most of the time, when we find ourselves in such places, you know your weakness and you know your strength. You know what actually works for you and what will not work for you. Somebody can decide to wake up at dawn and learn, but you know that wouldn't work for you. So you have to know your weakness, know your strength, build more on your strength, and for your weakness, try and identify somebody who can help you. Somebody who can actually understand your situation and help you on. When I was in medical school, I would say that I may have challenges, but I knew people that I can call on to help me. I remember taking ECG course, and I had to learn it severally to be able to understand. So you have to know your weakness and your strength. Then again, you also have to know that this is a time for you to have personal branding. How are you being known in the school? Are you being known as a very good student? When I say good, not good in academics, because everybody is good. For you to be able to be here, it means that you are good. But then there should be something sweet that will be said about you. As we embark on our clinical practice, it's a transition. But then when you go to the ward, there are things that you have to respect. You shouldn't have policy. There are so many times that even when I was working in the clinical setting, medical students are expected to be at the ward. You get there and they are not there. Because they may give excuses, because we close lectures late, we do this and do that. But then you shouldn't cut policy. We should remember that our patients are our greatest teachers. You've learned a lot, but then you are going to learn more from your patient. Diabetes, how to diagnose it today is never going to change. When you see it today, when you start working, it's the same diabetes that you are going to treat. I remember when we were in 5th year, we were at the emergency, and at that time it was mandatory for us to be at the emergency when we were having pediatric rotation. And then there was a baby with neonatal jaundice with copper hematoma. My brain, we were looking at this baby and our focus was on the neonatal jaundice. Then in the evening for the ward round, the consultant stepped in, saw the baby and said, this baby has Down syndrome. And trust me, we've been with this baby for more than 2 hours. We didn't notice it because we've learned in the books that those 30 years is this and that, but then there was a baby with Down syndrome and we didn't even notice it. It tells you the importance of going to the ward. So let's apply ourselves in all ward teachings and any other teachings that will be scheduled for us. As we also go to the wards, we should treat our patients with the best of care. We shouldn't go and attack patients. Sometimes people walk to the ward, where is the patient with heart block? No, it shouldn't happen. You should know your patients, address them by their names. Know the condition, walk to their bedside and mention their name. Don't ask them by the conditions that they came with. Sometimes it's very good, it's heartening for the patient to know. Even at the ward, when we are reading our history, I present to you a 45-year-old patient with HIV. Put yourself in that patient's situation. Will you be happy if your condition is just being mentioned during ward rounds? You should learn to use the way that would be comforting for our patient. You can present that I present a 45-year-old with uterine infection. That's why even other patients may not know. So we should learn how to choose ways and how to respect our patients. Let's treat them with that confidentiality. It's possible you may go to the ward and you see a patient that you may know who is a friend to a friend and a friend to a friend. But please, as you've sworn the oath, confidentiality should be key. We shouldn't go and disclose patient identity and information to people that we know. And I also want to talk about respect for our other clinical staff. The nurse on the ward, the ward assistant, the audience have been on the ward for so many years. They know the things that you are coming to learn. So you have to respect them to learn. It will be the midwife to teach you how to do survival care. You've learned it, but then when you go, it's a nurse who is going to help you learn the things, to help you to acquire the skills that you need for your practice. If you go to the ward and you don't apply yourself now, trust me, when you become a doctor, you will not apply yourself. When you're being called, Dr. A, does this patient on the ward, you give excuses because you don't have the skills. You may have it in books, but you will never have the skills. I also want to touch about teamwork. And for this, I want you to look at the person sitting by you and tell that person that I will ensure that I graduate with you. Yes, that should be the spirit. Medical school is fine, there are going to be awards. People will definitely get their awards, but then you have to be each other's keeper. We have the adage that C1, can we continue? C1, C1, do one, teach one. You get it? So you shouldn't be selfish. You shouldn't hide your load. You shouldn't hide things that you think other person will need. You should be each other's keeper. Let that team spirit be among you. And on the day of graduation, you will all be here in graduation. I have a personal story because when I entered medical school at the age of 30, so you can do the calculation. And I decided to, by the time I finished, I was, by the grace of God, I had 3 certificates. And that was 1 MPC and 2 birth certificates. And I must say that my class, they were very supportive. Very, very, very supportive. I'll go for lectures, I'll be doing Zoom. Right at the time I said, don't worry, I'll come and teach you in your room. You should identify people who will need help, those who are capable. Try and help them so that at the end of it all, you will all graduate at this time. And finally, I want to talk about your relationship with your lecturers. I still follow lecturers for recommendation letters. I fall on them on reference letters and other things. So you should know that the life that you are living here today, you are writing your own reference letter. You are writing your own recommendation letter. So it should be something that you'll be proud of when it is put before you. And finally, I want to say that to our parents and families, on behalf of the inductees, I want to say a very big thank you and we salute you for your support.